Hello, my name is Katie Johnson. I'm with Hawthorne Pharmacy in Lugoff. The month of May is High Blood Pressure or Hypertension Education Month. So today we're going to talk about blood pressure and how you can manage it. Blood pressure is when the heart pumps blood through the arteries and that blood puts pressure on the artery walls. When you have high blood pressure, that means your blood vessels constantly have an elevated pressure. The higher that pressure, the harder the heart must work to pump blood throughout the body. Around 45% of adults in the U.S. have hypertension, which is defined as a systolic blood pressure of 130 or greater, or a diastolic blood pressure of 80 or greater, or are taking medication for hypertension. That is almost half of the U.S. population. Blood pressure is measured by two numbers. The top number is called the systolic blood pressure, which measures the pressure in the arteries when the heart beats. And the bottom number is called the diastolic blood pressure, which measures the pressure of the arteries when the heart rests between beats. Hypertension or high blood pressure often is called the silent killer, because you usually do not show symptoms, but having high blood pressure is a risk factor for heart disease and stroke. Normal blood pressure is considered less than 120 over 80. An elevated blood pressure is considered anything from 120 to 129 and above to anything over 80. Hypertension is not actually diagnosed until you're at 130 over 80. So therefore, most healthcare professionals say the goal of blood pressure is under 130 over 80. So what can you do to help prevent high blood pressure or lower the high blood pressure you already have? There's things you can do as far as lifestyle modification. The heart healthy diet is called the DASH diet, which is dietary approaches to stop hypertension. The mainstay of this diet, of course, is sodium restriction. 2,300 milligrams of sodium per day or lower is the goal. This diet also includes a diet of lower in fat and higher in fiber, which would include more whole grains, fruits, and vegetables. Weight loss for overweight or obese people can also help lower the blood pressure. Increased physical activity is helpful for the blood pressure. That would be defined at about 150 minutes per week. So about 30 minutes of exercise 5 days a week. To wrap up, monitoring blood pressure regularly at home combined with regular checkups with the doctor can help control hypertension and lower the risk of heart disease and stroke. It's very important to take your blood pressure medications as prescribed because these medications are keeping the blood pressure at a healthy level and reducing your risk for developing heart disease and stroke. Hope everyone has a great May, and thank you for listening.